Welcome to A Balanced Life on the Go. I'm Dr. Nicole Lindsay, your host on this podcast, along with Dr. Brian Jeanette. This is a podcast designed to help connect you to a more balanced life on the go. Each week, we will bring you simple, concise, and easy to implement ideas, tips, and strategies to help you connect to better nutrition, movement, and thinking so you can achieve balance in your busy life. Isn't this what life is all about? Trying to achieve balance so that we can be healthy, happy, and live to our fullest potential. We're glad you joined us. Let's get started. Hi, everybody. Welcome. It's Dr. Nicole Lindsay.
And I'm Dr. Brian Jeanette.
And I'm Mackenzie Kerner.
Our student intern here at Back in Balance. Welcome. Today, we want to talk to you about pregnancy and chiropractic.
A lot of people would think that a pregnant woman can't get adjusted, or that it's not safe to adjust a pregnant woman, or how do you even adjust a pregnant woman with this big belly in the way? So today we want to go through a couple different things about how safe chiropractic adjustment is for pregnancy and how beneficial it is for both mom and baby.
And we're going to give you 3 ways chiropractic can help during pregnancy. I am sure there are many more. I know I was adjusted throughout my pregnancy.
I adjusted my wife all the time during her pregnancy.
And I was even adjusted in labor. My chiropractor came right here at Mission Hospital and adjusted me in labor.
Don't tell Mission employees that.
Yes, we had to sneak her in on the fly, that's for sure.
Yeah. So we want to talk about, what's going on during the body, what's going on with a woman's body during pregnancy, about the physical strain, about the development of the baby, about the development of the woman's body itself, and then how the chiropractic adjustment can help to alleviate some of that and actually help alleviate a lot of the issues that go along with pregnancy, and then help to have an easier birth.
Yes, but of course, like all of our podcasts, we have to stop and take a minute and what socks? We got to talk about socks. What are you wearing on your feet today?
I forgot about today's podcast when I got dressed this morning, so I'm just wearing plain blue socks. Nothing super fancy.
Mackenzie, what are you wearing?
No shows.
Mackenzie doesn't believe in socks.
And Mackenzie is a student intern here with us, and this is her very first Facebook Live.
Yes.
Probably first podcast episode.
Yep.
As well. So she is day 2. We are breaking her in and teaching her the ropes. So be easy on her. Give her a shout out. Give her a comment down there. So let's just jump in. Let's talk about what happens to a woman's body during pregnancy. Whew, that growing belly. It's definitely something to cherish. It was an awesome experience for me, probably for Lisa too. You don't have any babies yet, but with that growing belly comes a lot of things that go out of balance, physically, hormonally, on many levels, emotionally. So it can pose a lot of challenges for both mom and baby, for sure.
So what actually happens, obviously we know that there is weight gain that comes along with that, but as that baby is developing, as that baby gets bigger, more cells form, taking up more space, that belly actually starts to expand. And as that belly expands, that baby expands, all of the internal organs get pushed to the side. What's also getting pushed to the side and having restriction in motion is the spine. The lumbar spine, the thoracic spine. We can talk about your pelvis being restricted as well, and your sacrum having a lot of restrictions. All of these things cause, the things that we Google, low back pain during pregnancy, sciatic nerve pain during pregnancy, sacroiliac pain during pregnancy, round ligament pain during pregnancy. We all Google these things, but it's all just a form of what's happening as that baby is growing and getting bigger.
Yeah, if we look at what happens to a woman's body, we can kind of divide it into 2 sections. I'm sure there's a whole lot more, but just for today's purpose, there's the physical strain on the body, and then there's hormonal strain, and they kind of work together. So we look at physically, mom is gaining weight. I know I gained 50 pounds. I was on bed rest for 6 months of my pregnancy, which was absolutely horrible. But I gained 50 pounds, and I was like a size 4, and 50 pounds is a lot of weight for my frame. But that can pose a lot of issues. You can also have, with the protruding belly, you're putting a lot of stress and strain on your lumbar spine, so that can cause an increase in that curve in the lumbar spine. So we naturally do have a lordotic curve in our lower back, same in our cervical spine, but when we put all that weight out in the front, it pulls on that curve, and that can cause issues. Our center of gravity is also off, so our balance, and it's interesting how the human body can really account for all that and balance that out. It's pretty amazing. But yeah, your center of gravity is now different because you have all this weight out in front of you, and that's not how you've lived your life up to that point, so that's different.
Balance is off, your walking, your gait cycle is off, but also during that first trimester, those first few weeks of pregnancy, they're so precious and they're so important. Your body is expending and exuding so much energy to try and help that baby grow and help that baby develop normally. So what's going on is that your body cares more about the baby than it actually cares about your own body. So that's where,
for sure.
Yeah. So that's where we start to actually have those, we'll call them deficiencies that arise in pregnancy. We never experienced any low back pain or sciatica before, never experienced any wrist pain or carpal tunnel before, and all of a sudden, boom, you have these issues. Well, your body doesn't care about your low back pain. Your body cares about keeping your baby stable, about keeping your baby healthy,
alive.
and about alive and growing. So a couple ways that we can help to mitigate a lot of these issues that arise during pregnancy is what we're going to talk about today, obviously pertaining around chiropractic and the chiropractic adjustment, and how 3 ways chiropractic care can help you during your pregnancy.
Yes, so 75% of women experience low back pain during pregnancy. That's a lot.
That is a lot.
That's a lot. I mean, just in general, what percent of the population suffers from low back pain? Do you
Like
know that?
80%,
Yeah.
I think.
Of the population.
Of the population.
Yeah, so I guess that's almost the same for
Yeah, it tracks.
women.
It tracks.
75%.
The odds are definitely not in your favor.
Yeah, so I mean, when a woman is pregnant, she has a couple options with low back pain. I mean, she can take over-the-counter NSAIDs.
Which
we're
I think
told that
everybody,
they're, safe.
I think intuitively most people probably don't do that, but there are a lot of people.
There are people that do.
do.
I mean, there are some pregnant women that even take opioids. There's that statistic is really high. I know I did some research on that a while back, and it was actually higher than what I thought it should be. But that can happen, and then women can come see a chiropractor. They can come get hands-on work, and that's actually one of the first ways we're going to talk about. Regular visits to a chiropractor can help mom with back pain, hip pain, with the sciatica that Dr. Brian talked about, pubic symphysis pain, round ligament pain, and even carpal tunnel. We know that hormonally, our bodies are releasing relaxin, and that's causing our body to kind of grow and expand and open up so that we can grow for the baby and eventually labor the baby. But that can also make our joints unstable, and our wrists, that can happen there, and other joints of our body. So that's the first thing that we can do is come get adjusted.
Yeah. Let's talk about what the research actually says about this. So in actually one study in Switzerland, what they do is they followed 115 pregnant women, and they followed them for an entire year. They went to go see a chiropractor because they were complaining of, their main complaint was low back pain. What they found in the study is that over half of these patients said that they improved after just 1 week of chiropractic care. After 1 month, that figure had grown from 50% to 70%. So now, even after 4 weeks of care, we're at almost 2/3 of the study participants reporting that they improved and felt better from being adjusted during pregnancy. By the end of the study, over 90% of these women, of these moms who actually entered the study, said that their pain was better. At the very end, 85% of them said that they were happy with the care that they received and that they would actually continue going to a chiropractor. So this really tells us that there's a big chance that being under chiropractic care can alleviate a lot of your physical discomfort from being pregnant. I wasn't pregnant. Obviously, my wife was, but I saw firsthand just how uncomfortable she kept on getting as her belly kept getting larger, as the trimesters, as the weeks kept growing. And then you hit that third trimester, 32, 34, 35, 36 weeks, and all you're saying is, oh my God, get this baby out of me. My body can't handle it anymore.
Yeah, you can literally hear your skin stretching at night. I mean, it's just, it's crazy. But yeah, we'll put the site to this research article in the show notes as well, so you can check that out yourself. But yeah, that's pretty amazing. Pretty good statistics there. Like we said, cuts down on NSAIDs, opioids, and pain and suffering. No need to suffer when you come get adjusted. Yeah. So let's just explain, what does a chiropractic adjustment look like for a pregnant woman?
Yeah. So there's a couple ways that we can actually adjust pregnant women. We adjust pregnant women essentially the same that we would adjust a non-pregnant human being. But we would definitely take a lot of extra care in our assessment, our evaluation, and then our execution of the adjustment with somebody that is pregnant.
Yeah. And we would do the same thing like with any patient. We're going to have the patient come in. We're going to do an assessment, an exam. Definitely not take x-rays. We do take x-rays on other patients when needed. But we're going to then create the best recommendation and care plan for the patient. It may involve adjustments with modalities that are safe for pregnant mom, that can help with the soft tissue, alleviate muscle spasms, inflammation, and help us get the desired results for the patient.
Mm-hmm. In a newly pregnant mom, a lot of the times we can actually still lay face down. That will allow us to do our assessment on the spine, the lumbar spine, the pelvis, and the sacrum. But as that baby starts to grow, obviously our body positioning and our assessment is going to have to change and grow as that starts to develop. So one of the ways that we can use this is there's actually two ways that chiropractors do this. The first way is that they have a special table where a lot of the moms can lay face down, and the piece that sits underneath the belly can drop away. This is really nice because a lot of women are stomach sleepers. Or they really like laying on their stomach, then as this belly gets bigger, they can't. So even just having a table that they can lay face down on and have that piece sway away, they love it.
Yeah, it eliminates that sense of gravity from being upright to being face down, and they don't have any kind of restrictions when they can go face down.
Absolutely.
Not to mention the breast too. I mean, it's just tender as can be, and there's pillows that you can lay there as well to alleviate the pressure.
That's actually that's the second way that we can do this is they actually have these big pregnancy pillows. It's like this huge 2-foot thick styrofoam or foam pad that's got a little egg shape cut out in the center of it that you can lay down, and takes a lot of the pressure off of the belly.
Mm-hmm. And the adjustments involve us using our hands and applying a gentle force into the table. Some of the pieces of the table may drop, make a noise, sometimes it doesn't. Sometimes you can hear releases in your spine. Sometimes we can use instruments, activator or arthrostim, if we need to use a more gentle approach. We'll also do some soft tissue work. Sometimes the round ligament, it's that ligament that attaches from the uterus down to the pubic bone. And in a non-pregnant woman, that ligament is only 2 inches. But when a woman becomes pregnant in the 3rd trimester, it can get up to 8 inches in length. So you can imagine how that ligament is tight and taut and can develop little nodules and trigger points in there. And we can feel that can put a lot of tension on the uterus. And we can release that trigger point. We do that by getting in there with our hands or thumbs and kind of massaging that out, if you will, trigger point release in there.
Similar with ligaments in the sacrum as well. A lot of pregnant women have, pain in their pelvis and sacrum, so you could go in and do soft tissue work on the sacrotuberous ligaments as well, because those are really, really tight. And if the sacrum moves better, then the delivery is going to be easier for the baby as well.
So why would we want to adjust to pregnant women? We've already talked about the pain aspect of this, and for a lot of women, for a lot of people, getting adjusted is starts off as pain, but then increases just wanting to improve function. When we're pregnant, we have this differing of muscle imbalances and neurological signal imbalances to the uterus, to the pelvis, to the muscles in the core. What happens is that's what chiropractors call a subluxation, right? And so this kind of blocks or impedes a lot of those nervous system flow to that. That flow helps our body intuitively know how the pelvis should be structured and how the muscles should be fired. Well, you have this 30-pound object that's sitting in your belly with fluid and baby that is interrupting all of those signals. Your body knows how to do it, but it blocks it, and it makes it harder for you to overcome a lot of these compensations that we have in life. So with doing the adjustment and doing the soft tissue work on the muscles, the ligaments, and the pelvis, and the tendons, what we're doing is we're actually sending more nervous system, neurological input back up to the brain, so your body has a stronger ability to combat a lot of that extra moving instability that Dr. Nicole had already talked about.
I love that you brought that up, because here's the thing. Yes, a lot of pregnant women come in because they hurt, because of pain. You don't have to just wait for pain, or, there are other, like you said, you can come to a chiropractor when you're pregnant just because you want to make sure that your nervous system is functioning 100%. Because guess what is helping to create the nervous system of the developing fetus in your belly? Your brain, your nervous system, your body. So if there are interferences, if there are subluxations, if there are problems in moms, I'm just reiterating what you said, because I think it's just that important that we don't want to just think of chiropractic care for pregnant women for back pain. Of course, that's easy. We'll get rid of your pain and make your pregnancy more comfortable. But let's think about creating a healthier nervous system for your baby. This is when your baby's nervous system tracks are being laid down. This will determine the ultimate health of your baby. Why wouldn't you want to get adjusted? Why wouldn't you want to make sure your nervous system is clear of interference and working at 100%?
I know, and it's awesome, and this is what we refer to as like the neurobiomechanical function of the pelvis and just of everything that's happening down there. But how does this actually happen? So the second thing that we want to go through is actually what the adjustments do. These adjustments are designed to reestablish the balance and the alignment in that mom's pelvis and the mom's spine, and this directly benefits the baby. A perfect example of the way that we can think about this, something really easy, is compensations that develop throughout life. In today's world, in today's day and age, lots of pregnant women are working pregnant women. And their bodies go through different things every day that they might not have gone through 100, 150 years ago. For example, sitting, right? We sit 50% of the day, 60% of the day, 8 hours, 9 hours, 10 hours. What that does is that creates imbalances and misalignments in the lumbar spine, in the pelvis, and the sacrum that actually make pregnancy, labor, and delivery much more difficult. Yeah. You're already running uphill. You are already working towards going through a marathon that's delivery. Why do you want to weigh yourself down and make your marathon running, labor, delivery even more challenging?
And here's why. Sitting, the human body is not made to sit for 8 hours a day, but we do, and we do it when we're pregnant. So what happens is the sacrum, the lumbar spine, the muscles, the round ligament, the sacrotuberous, all of this gets tight and taut. Now, what happens when we have a normal, healthy pelvis, the baby can move within the uterus, but when we have tension and things become twisted and tight, that restricts movement for baby. And what that could mean is not only pain for mom, potentially, but it could mean problems for baby. Some kind of
these like external
constraint.
Forces, like they can obstruct actually the growing baby's normal movements. This is like intrauterine obstruction, intrauterine complaint. This is not the only outcome of this, but a lot of like occiput or skull deformities, modalities that happen with babies as well. They come out and you see a baby wearing a helmet. So we have to restructure the way that their skull is, and we can contribute a small portion of that to obstructions in the uterus.
Right, and then when baby is supposed to turn, head down, face up.
Sunny side, yeah.
Yeah. Then when there's constraint in there, is the baby able to get in that position properly? And could this lead to a breech presentation or something worse, So this is why, number 2, adjustments help reestablish balance in mom's pelvis and spine. which can benefit mom, but can also benefit the baby as well.
Lowering your chances of having what Dr. Nicole just said with that breech presentation, a posterior position, like where the baby is sunny side up, or the baby comes out face up. And this also just helps you just have a better optimal birthing position for mom and for baby.
Yes, and improving outcome for labor and delivery. I know for me that was really important to me. I wanted a natural childbirth. I did not want, I was realistic. I knew that which is why I choose to have my baby in a hospital in the event that something did happen. But I was really adamant about no interventions, no epidurals, nothing. Don't offer me that unless, it's a 911 situation. But when you get adjusted, you can really help eliminate that kind of stuff even more. And we actually have a study, which we'll also put that in the show notes as well, a link so you can look at that. But one study reports that new moms experience, on average, a 25% reduction in the length of labor time with chiropractic care during pregnancy, and that rises to 31% reduction for mothers who have given birth before. So that's huge, because I know my labor was 17 hours, and at hour 12, everybody started getting nervous. The nurses, the doctors, they were all looking at their watches, but my body was doing fine.
It's a money-making business.
Yeah.
After 12 hours, you got to flip the room.
I realized I was costing them a lot of money, costing myself a lot of money in the hotel mission, but I was I was okay with it. Everything was fine. My heart rate was good. Baby's heart rate was good. Everything was progressing. Just patience, So chiropractic care, had I not had chiropractic care throughout my pregnancy, instead of 17 hours, it may have been 24 hours. I may have given up because at that point I would have been exhausted. I don't know. But chiropractic care is important.
Yeah, I think that leads into a really good future podcast where we can actually talk about the rates of scheduled cesarean sections and the rates of emergency cesarean sections. The United States is one of the most, if not the most developed nation in the world. We have some of the most medical treatments in the world, and we're the best at emergency medical care. But what we really lack in is preventative, holistic health care. Why do we have so much knowledge, so much information, so much ability to be healthy, but we have the highest rate of cesarean sections in the entire known world?
That's a whole nother topic.
So that's a whole other
topic.
Yeah.
If we can cut down on and just like Dr. Nicole said, her game plan was to go in and have a natural delivery. A lot of women have that same game plan, but the plan never survives contact with the enemy. Same thing holds here.
Yeah.
But you have to plan for that. But if you don't take the 4 steps to ensure a successful outcome, your plan will fail, and you might have to have those interventions. So one way that we can do that is by actually getting adjusted before, during, and after pregnancy.
Yeah, and creating a birth plan. That's something that I think we should make all women do. What do you want to see your pregnancy like? I mean, I know there's, be real and be open to, if we have to go this way, but what do you want? What's your goal? Most women just go into it and let their healthcare providers decide that for them. But you are ultimately, you and baby are in control, right? So what do you want to see? How do you want it to be? And then you can read books like I did and practice different things that lead you in that way. And I'm glad I did prepare for it, because it was hard, and had I not, I probably would have went that way.
Yeah.
So let's talk about the third way chiropractic can help pregnancy.
Yeah.
This is really exciting. This excites me.
Which is exactly what we just said. It's to give you the best chance for a natural, safe vaginal birth, which is where these adjustments can actually help you have more control over your pelvic floor, making that childbirthing process easier.
Your pelvic floor. Adjustments can help you have more control of your pelvic floor. So this is not only important for pregnant women, for you during pregnancy, but before pregnancy, after pregnancy, all ages. All of us need help with this and should want really good, strong pelvic floor muscles.
Some of the stuff that we're going to talk about right now, if there wasn't research to back it up, I probably wouldn't believe.
Yeah.
I probably wouldn't have believed.
I didn't, until we started researching for this, I didn't know this. I didn't know the research. Did they teach you this in school about the pelvic floor?
They did, actually. They did.
Cool.
The curriculum is changing.
Awesome. Love it. Yeah. Yeah. So when we contract our pelvic floor muscles, the left and right side of your pelvic floor muscles are supposed to contract at the same time. So what can happen when we have subluxations between our brain and that part of our body, then these muscles can get off balance, and one side can contract out of sync with the other, or maybe one side doesn't contract at all. And this can cause weakness in the pelvic floor muscle, just not having control when you need it the most.
And this is what helps cause these misalignments or imbalances in the lumbar spine, sacrum, and pelvis. And the pelvic floor muscles, which you can think about this, you can think about your core, right? So the example is a soda can. There's the very top of the soda can, which is your diaphragm. The sides of the soda can are your core muscles, your rectus abdominis, your six-pack muscles. And then underneath the base of that soda can is your pelvic floor muscle. And these pelvic floor muscles are known to have a very, very active role in pregnancy, childbirth, and spinal stabilization post-delivery. And when these pelvic floor muscles aren't working, they can really cause a whole lot of issues during and after. An example would be urinary incontinence.
Yes. So, in labor, it's really important that you are able to connect with those muscles and use them when needed. I remember that being a really hard time in labor. I actually pushed for 4 hours. Pushing should be 30 minutes. And I just couldn't really connect. I remember my husband just saying, he was trying to get me to do that. And I was just like, I guess it was exhaustion, everything else, but really important, especially at that point in your labor when it really matters. That's when you need to have control of those muscles. So
that's where the example of the marathon comes in. She was in labor for 20 hours, and then 20 hours? 17 hours,
mm-hmm.
And then actual active pushing for 4 hours. So there's your marathon
mm-hmm.
right there. So you want to set yourself up for success by having complete control and strength over these muscles and having that pelvis be balanced. Again, you're running a marathon uphill with 30 pounds worth of weights and being dragged down by your husband or partner trying to
mm-hmm.
cheer you on, which I'm the person that if you're cheering me on and I'm struggling, don't cheer me on.
I'll remember that when you're in labor.
Yeah. So what that actually does is that in order to give you the best chance for this natural vaginal birth, women need to have strong pelvic floors that can contract, but also they can relax. Now the relaxation part is what we think of like being bad, like, oh, it's weak, it's not contracting enough. But we actually have to have this external-internal movement that happens with that pelvic floor so that baby can actually leave.
So this is what the research actually showed, was that adjustments, and we'll put the link to this one in the show notes as well. So there's 3 articles that we're citing. We're able, after adjustments, both pregnant women were able to relax their pelvic floor muscles significantly more than the women that were not pregnant. But what they also found is that, because they tested non-pregnant women in this research article, and they found that the women that were not pregnant, they were able to control their pelvic floor muscles like elite athletes were able to, which is telling us that adjustments not only help pregnant women, but can also help non-pregnant women. So really cool. I think that's a really important article, and we should all want to get adjusted to just have that effect.
And that's where that neurobiomechanical process that we were talking about earlier, that brain-body connection, if we can remove all the interference that your brain can control your muscles, then your muscles can actually work and be controlled like they should. We don't breathe because we tell our body to breathe. Our brain tells our body to breathe, and it's that same mechanism. Our pelvic floor contracts and relax based on the type of movement that we're doing: sitting, standing, squatting, delivering a baby, and or like growing a baby. Like, does that automatically. So again, giving its best fighting chance. And I know what a lot of you are thinking right now. It's like, chiropractic. Do I really want to be adjusted when I'm pregnant? Do I want to let my wife be adjusted when she's pregnant? Is that safe?
Is it safe?
Is it safe?
Yeah.
We hear that all the time.
Mm-hmm.
And absolutely, hands down, without a doubt, without question, adjusting a human being, a baby, a pregnant woman, is one of the safest things that you could do to actually help you get better. Again, we talked about taking Tylenol, we talked about taking ibuprofen, all these things that are not initially indicated when you're pregnant. Even Dr. Nicole already referenced an epidural. Well, there's opioids in the epidurals today.
Yeah.
So if there's things that we can do to help, stay off some of those things that you may or may not have to take, you may or may not have to utilize, and it's different for everybody. Let's do it.
Oh, and there is a couple more research articles regarding the safety of chiropractic care during pregnancy.
Always research articles.
Yes. So, if we haven't convinced you enough that chiropractic care is so beneficial to pregnant mom, it being safe should be another reason that we should do it. And we have some research that we'll put in the show notes as well that you can look at if you're worried about that. But it is absolutely safe. In fact, we collaborate and work with a lot of medical doctors in this area, in the Asheville area. They refer to us quite a bit for chiropractic care, and we even have OBGYNs that specifically refer to us with their pregnant mamas. They send their pregnant mamas here, and they trust us to take very good care of them as well. Grace OBGYN, Biltmore OBGYN, Dr. Vicki Scott. I'm sure I'm missing a few, but those are some of the offices around us that refer to us all the time. Mm-hmm. So there you have it. The ways that chiropractic can benefit you when you're pregnant. Of course, chiropractic can benefit you when you're not pregnant. We love chiropractic. If we can help you in any way, don't hesitate to reach out to us here at Back in Balance. You can check us out online as well, backinbalancewnc.com. Don't hesitate to reach out with questions, comments, emails. We're here to help.
The one thing that we want to leave you guys with today is if you are pregnant, if you're expecting, or if you're trying to get pregnant, you want to make sure that your pelvis is functioning, firing, and in alignment so that baby can develop easier, or your body can withstand it easier. I would say come on in and get an assessment to be adjusted.
Yes, that is the one easy thing you can do. All right, thank you for watching and listening. Hope you all have a wonderful day.
Thank you.